I saw this thing fall out of a tree next to me, and it literally landed not that far away from me. And at first, I didn't want to touch her because I thought she might bite me. Before I knew there were cats and foxes in the garden, so I knew if I just left her there, she'd be food. And I just didn't like the thought of that, so I just picked her up and then I plonked her on my shoulder. And ever since then, we've just sort of been together. As soon as I saw her, I just saw Pablo, without even knowing if she was a male or female. But from day one, I felt very affectionate towards her, and she seems to show a lot of affection back to me. Who's that? The last year, I've been dealing with a lot of anxiety, not being able to go out and meet new people, and just kind of struggling with an awful lot of things.
So how's Pablo doing today?
Since I met Pablo, it's given me that extra confidence to meet people and go out and socialise again.
Does she have a favourite children?
She does, and it's this one. I can't really think of life without her now, even though it's only been 3 weeks, which sounds crazy. Well, I knew from day one that there was something up with her because she wasn't flying around and she wasn't behaving like the other birds. And yeah, I just wanted to see if she gets better. I think the whole situation, a bird falling out of the sky that happened to land next to me, is very surreal. And I feel very lucky that it happened to me, to be honest. She's made such an impact. To lose her would be devastating, really.
This is Pablo, and I've come to see Jo. She's got a sore leg.
Hello.
Hi.
Hi, how you doing?
Not bad.
How's Pablo sleeping?
Some people will see parakeets as a pest. She's not an indigenous native species to the UK, but in her case, she is a pet to Luan, and they obviously have a very close relationship.
Can I have a little look at her?
Sure.
And just have a look and see how the leg's doing. She fell from a tree, right?
Yeah, she fell from a tree next to me. She still uses her leg, but she doesn't really...
She doesn't grip very well,
no.
does she? So I'm just checking whether she's actually able to use the foot to perch, because perching is so important for them. She's obviously using the left leg a bit more.
Yeah.
You found that when she's on your shoulder, she prefers to sit kind of one-legged.
Since I found her, she's been like this.
We just need to figure out why she's preferring to weight bear more with her left leg. And if she's not able to perch with the right foot properly, then she'll put all of her weight on the left foot, and that can lead to issues with the good leg.
Yeah.
So we just need to figure out why she's preferring to weight bear more with her left leg, even though she's able to grip quite well with the right one.
Yeah.
So I'm just gonna gently pop her in the towel so she doesn't get too stressed. And I'm just gonna quickly have a look at her 2 joints there. All right, Pablo. So what we'll do is we'll take an X-ray of her legs, and we can see how that joint's looking. She might have a fracture there, and infections can get into the joint.
Okay.
And so we want to make sure that she doesn't have that. To get good views, we need her to stay still, so we'll just give her a little bit of anaesthetic gas.
Okay. I'm remaining hopeful and optimistic, but yeah, I'm worried.
Okay, so if you want to wait for a little bit, and then I'll update you shortly when I've got some X-rays.
Okay.
Okay. Go. Hi, Nathan.
Hiya, what you got there?
This is Pablo.
Wow. So I'm guessing she's friendly.
Yeah, she's very friendly.
I think you turn into like the exotics vet now. We don't often get birds here.
Okay, Pablo, come on, darling.
So what are we doing then?
So we're going to take some X-rays of her legs. I'm worried there might be a fracture there. We'll have a look at the X-rays and have a look, but it's definitely that hook joint that's a bit swollen and why she's holding up the leg.
Well, let's hope you can find something on the X-rays and help her.
Okay, we're looking a little bit sleepy. Lights. X-rays. Nath,
Yeah?
I think it's It's a really bad fracture. You can just see the fracture there. You can see there.
It's really painful.
And this was obviously the swollen joint because everything else is up inside, but when she's asleep, that's why we can't extend the leg properly.
So this isn't good news for Pablo, and it's definitely not what I was hoping to find. And I did think Pablo probably had a fracture, but not this high up, so it's a lot more serious than I thought.
Here we go.
Pablo. Hello. How is she?
She recovered from the anaesthetic really well, really quickly. But I'm afraid the x-rays didn't give us the news that we wanted.
Right.
The fracture's quite high up. Surgery is an option, but we have to consider that she's a really high risk for any anaesthetic. And obviously that one would be longer than the anaesthetic we did to do the x-rays.
Okay.
But she's healthy, she's good weight, she's eating, and so, you know, her chances are reasonable, but bird anaesthetic is really risky.
I thought it was going to be very straightforward. I thought she might need some medicine or an operation or even some physio. And no, it's very disappointing.
The surgery is very high risk, so we have to consider the other option, which would be putting her to sleep, because with a fracture like that, she's going to be in a lot of pain.
I'll have to give it some thought, but I probably will go ahead with the surgery.
They're not great options. At least with surgery we can try and fix it and potentially have a good outcome with a usable leg that's not painful, even though it's a higher risk because she's a bird.
I want to give her the best fighting chance. I feel like she's sort of turned up at the right time. She's helped me an awful lot. Now it's my time to help her. Here we are, Pabs. I've decided to go ahead with the operation. It wasn't too difficult to come to because the other options were so miserable. I mean, putting someone down that you love, it was a clear choice to go ahead with the operation.
Hi, Luan.
Hiya.
This is Scott.
Hi, Luan. How are you? Nice to meet you. Hello, Pablo. Aren't you gorgeous? All right, well, it's a big day, so let's go in and have a chat, shall we? Come on in. When Joe first showed me the x-rays, it was very clear that this was a fracture that needed to be fixed. There's two sharp ends of the femur, which is the thigh bone in the upper part of the leg, and they were broken in half and folded over. It's a pretty nasty break in this right leg, isn't it?
Yeah.
How are you feeling about that?
I'm upset to hear that, she's got such a serious fracture, but, I want to do the best for her, so go ahead with the operation.
Okay. The main concerns for us is the anaesthetic. But the problem we have with her is that she is going to need to be under anaesthetic for quite a while, for maybe anything up to an hour.
Yeah.
And that is always risky in birds. So we are quite concerned about that. And then of course, she's a young bird. And as a result, her bones aren't fully calcified and as hard as they should be. Mm-hmm. And so that will mean that there's chances that whilst placing a pin, they may fracture. So yeah, there's a couple of concerns we've got. Well, I'd say more than a couple. Mm-hmm. Hey.
She must be up higher.
You do. Hey? I see Daddy's quite nervous.
Yeah, I'm definitely nervous.
Yeah, I know. We're nervous too, because it's not something that you have to do every day. It's something that we have done a lot of research and a lot of study in preparation for today, but something that we're really, really hoping goes well and will give you the result you want, which is a bird at the other end.
Just fingers crossed. Literally in the last 3 weeks, we've bonded so much and so quickly, and the fact that there's such a risk that I might lose her, yeah, it's been difficult. Good luck, Pablo. I'm expecting the worst, but I'm hoping for the best.
We will give you a call as soon as she has woken up.
All right.
In the meantime, just cross hands, toes, fingers, whatever you can find.
Yep.
All right,
Thank you very
mate.
much.
Take care. We'll see you in a bit.
See ya.
Bye. Here's little Pablo.
Hello, who's this?
So this is Pablo.
Isn't she gorgeous?
Pablo. She.
Yes.
Chi.
Apparently, yeah, Pablo called Chi, yes.
Pablo is
Yes, that's the
Chi.
least of her worries today, Ems.
Yeah, I hear she's not doing so good on one of those pins.
Yeah, so the right leg has got a fracture, and that's what we're all here for today. So I think the big thing we all have to remember is it's all about efficiency. We need to make sure that we do things as well as we can, but as quick as we can.
Yeah.
So we just need to be the most well-oiled team that we've ever been to get the job done and
Yeah.
hopefully get Pablo through and back to Luan.
Okay.
We know there's risks, and I know that we all are nervous. I mean, I'm feeling nervous. I know that you guys are as well.
Yeah.
But all we can do is just do our very best. So we're breathing there, fine. So you can see the small light breaths there, okay? So now every 15 seconds, you're breathing. Right?
Yeah.
Birds are very delicate little creatures. They're very prone to stress, and under anaesthetic, they can just simply die. So it is a very nerve-wracking thing to knock a bird out under anaesthetic, and we need to make sure that we're all on our A game today. There we go, so knee there. Just feeling the fracture site properly for the first time. She's just so stiff. This fracture feels a lot different to what it looks like on X-ray. The muscles are so tight here that they've actually pulled this fracture underneath its knee. So it's like having a tip joint in its knee in the same position, which is clearly not correct. So what we've got here is very, very abnormal indeed. And because it's been like that for 3 weeks, all the muscles have contracted and it's led to a right mess. But unfortunately, I can't see how I'm going to fix this surgically, because to do so, I basically have to refracture the leg.
Is amputation an option?
I don't think we need to. The reason I don't think we need to is because she can feel her leg. She can feel her leg, she can place her foot, she can hold the toes around my finger. So I'm feeling now that actually we should pull out and we should allow her to wake up, because although this isn't a perfect life for her, I'd rather her be alive. And I think that she is relatively comfortable. I think that the fracture has healed, however badly. And I think that, Luan loves this bird, and I don't want to be the one that breaks his heart. Hello, sweetheart. Although we'd love to have pinned the leg, there actually was no need to. And even though it might make you look like you've got a bit of egg on your face because you thought you were going to go one way, but actually you went another, well, you've just got to brush the ego off and get on with it and get the best result for the animal. And for the animal, and I think for Luan, the best thing was to leave well alone. This bird is perfectly healthy. It has a weird short leg, but she's going to be absolutely fine. Welcome back.
I think she's hungry.
She's like, get off my leg. I wanted to have a perfect leg, but hey. It seems from the examination that we've done today that Pablo isn't in any pain. There isn't any chance that those sharp edges of the fracture site could cause any further damage. The healing's been done. It's not perfect by any means, but it's perfect enough.
Hey.
Here we go.
Oh, how'd it go?
Well, it was eventful. Your bird has something we're going to newly describe as a fifle, which is basically a very odd leg, knee, thigh joint.
So it's just a fused callus, so it'll always be deformed and she'll always have that kind of claw-like perch. But she can still perch and she's not in pain.
And is that not risk of infection or anything like that?
No, because the fracture is on the inside. The slightly sharp bit of the fracture that we can feel is on the inside of her knee. So it's protected from anything on the outside.
And it's great that we've been able to give back to you in one piece, and that's exactly what we wanted to do. And we know that we've gone through the process to try and give her the best treatment we can, and actually it turns out by doing nothing is the best treatment we can give her.
I really wasn't expecting a happy outcome, if I'm honest. I mean, I know I said I was remaining hopeful and so on, but just the chance of her not making it, I'm pretty happy. She's in good health and her foot's healing itself naturally, and that she can come to work with me tomorrow again, back to normal.
Ready? Ready? Yeah! Hugo and I, when we go to the park, we play a kind of game where it's like who's gonna move first. You kind of like duck around. Come on! Woo! one of us moves and runs, and we just run around and jumping. You okay? I've always loved big dogs. So I was going into the vets to buy some special cat food for our cat, and there was this beautiful dog in there, turned out to be Hugo. And basically the guy who had Hugo just said, "Do you want him?" And I was like, "What?" Thought it was a big joke. Basically, it just wasn't going so well with this person. Him and the dog just didn't really gel, and he wasn't happy and the dog wasn't happy. Lovely boy. And there was Hugo, just so cuddly and friendly, and yeah, he was so handsome, I just decided to go for it. Look at that happy face. Yeah, happy dog. When we met him, he had this lovable nature around him, but there was just this insecurity. You could see that he didn't quite feel safe in the world, and I really related to that. And I said that to him, and I said, you know, I'm going to take you by the paw and we're going to do this together. You know, you and me, we're going to feel safe in this world together. Can you do some up dog with me? No, just sleep dog. I work for myself, and I was finding that I could get a bit lonely during the day. Oh, very good, Hugo. And just being here with Hugo now just makes all the difference. We're not really nervous about his first vet visit. I think it's just to be sure and to be on the safe side. We just want to have him checked over. Every day I just look at him and just fall in love with him a little bit more. He's just the most gorgeous being, and I adore him.
I love you. Yes, I do.
You alright, mate?
Oh, I'm a bit nervous, to be honest. Hope there's nothing wrong with me.
I'm sure you're going to be fine.
Hello, you must be Hugo.
Yeah, this is Hugo.
Look at you. Hey, you've got to have a voice like that. Has he got a voice like that?
Hello, my name's Hugo. I'm very handsome.
It's absolutely beautiful, aren't you, mate? I have a secret passion for big, buffy dogs, and he very much fits the bill. He's a perfect dog.
Should we go and see you in the consult room?
If I have to.
Come on then, let's go.
Natalie's just got Hugo, so we don't really have much history, so it's really important that we do a full physical exam just to make sure that he's healthy as he starts his new life. I can tell you guys are a little bit in love already, aren't you?
Completely. It was love at first sight.
Can I have an examination of you, hey?
Well, I suppose it's for my own good, isn't it?
Very rarely when I'm treating animals do I hear them speak, but for Hugo, he's got an incredible deep, booming voice in the form of Natalie.
The old ticker okay?
Sounds good, yeah.
Let's have a look at those big choppers, hey? Okay. Ooh. Okay. Is that the first time you've seen that, Natalie?
Yeah.
Whenever you see a lump in the mouth of an animal, that's always a concern. The reason being is they're very black or white. They're either completely benign and nothing to worry about, or fiendishly malignant. And the animals that have that type of tumour can be dead within months.
If it was anything untoward, would he be having any symptoms?
When it progresses, there's things like bleeding from the mouth. You might have some pain when he's chewing things. You might see some loose teeth. All those things might be something. Are you seeing any of that at all?
No, there's sometimes a little bit of blood if he chews like a really big, like one of those big rawhide bones.
Okay. So that's very much something that we need to look at straight away. It's not something we want to leave.
Yeah.
And particularly the love affair that you guys have already struck.
No.
We don't want to break your relationship up, and I think sometimes we have to jump on these things quickly and just make sure it doesn't get out of control. As a vet, we see relationships between owners and animals all the time, but the relationship that Natalie has with this dog so soon is incredible.
I'll probably be fine, Hugo. Eh?
She absolutely adores him.
Baby boy, you're gonna go for a little sleep. And then after that, we'll find out what's wrong.
He's only just come into our lives, so I just can't imagine or think about it not being okay.
Natalie, you're staying with me,
See
buddy.
you later, baby.
my bite. Oh, God.
Come on then, Hugo. Good boy. Hey, Ems.
Oh my goodness! Hello. I know you said you were bringing me a big dog, but this is
A horse.
a horse.
He's a horse. He's a big, handsome horse. Yes, he is.
Hi, buddy.
Then what's your story? Hey?
Well, this is Hugo. He's a rescue boy, and unfortunately, I've just found a lump above his canine. It just looks a little bit nasty. And as you know, with oral tumours, they're always something to be a little bit wary of.
Yeah, absolutely.
So what we need to do is knock out this boy, and then we just need to take it out and send it off to the lab.
Okay.
What are you doing? Didn't come here for a haircut, mate.
Oh, I know.
Oh, so big, it's scary. Come on. I know. I know. It's a horrid noise, isn't it? So you get used to it.
Good
You're a big baby, aren't you?
Oh, my goodness. Is he snapping? Is he getting snappy?
To knock out Hugo, we need to place an IV catheter, which allows me to give him the anaesthetic he needs. But unfortunately, big Hugo is a bit of a baby, and he doesn't like the clippers. And it's all done, see?
That is all done,
It's all
buddy.
done. There, you're friends again. Thank you. We're friends. All right, so sleepy time now. I'll get that nasty lump out of your mouth, shall we?
When we deal with these massive patients, it is a bit of a mission to get them anaesthetised appropriately and correctly while trying to manage their size. So it's definitely putting us to the test.
Okay, one, two, three. Now that Hugo's under anaesthetic, I can really see this lump, and it's a very angry looking thing, and it's extending quite a long way down the enamel of his canine. So what I'm going to do is basically cut it off at where the gum line should be, and hopefully in future that'll mean that he won't bleed as much when he's chewing things. Right, well, Em's alongside, and it's just I need you to be chief lip holder.
It's not a title I get assigned every day of the week.
No. This isn't the most elegant of surgeries. I'm literally just going to have to lop it off and try and get it back to where the normal tooth gum interface will be, which is sort of right back here. That will just lift away. Okay. One nasty lump removed. All right, so that's that. He's got a lovely new gum line. Got the horrible lump off, so I think it's time to wake him up. Good boy, there we go.
Good boy.
There we go. Oh dear. If it is something sinister, it's really concerning. So we'll just have to wait and see, cross our fingers, and hope for the best. Boy.
If you hear that there's something wrong with your animal, even if it's a small thing, there's always a slight cause for concern, because you just hope that it's not going to become a bigger problem, and hopefully it's nothing to worry about. So I'll try not to think about it.
Oh, I can hear
Hi.
Hello.
Here you go, who's this?
How's my boy? Hello. Hello. It's me. I cannot believe you're not more excited. Oh, you a bit dozy. How's your mouth, Poppy?
Yeah, I'm really happy with the result.
Yeah.
It came away really nicely, and now he's got a nice, clean gum line. You'll be able to see. So that's normal, and then this is the new one. So you can see it's nice and straight and clean now.
Oh, yeah.
Yeah.
Wow, what a difference.
So I think that just by removing the tumour, it's going to improve his quality of life, because the bleeding that you've seen, I think, is because that growth, whatever it turns out to be, has been growing down the tooth, and as a result, has led to just getting in the way of normal chewing and biting and things. So I think we're going to have made a big difference to that. And now we've just got that anxious wait for the next few days.
The results.
Yeah. You a bit anxious too about it, hey?
Yeah. Very happy that the lump's come away, that it's come away clean. Obviously apprehensive about the results, because we still have to wait a few days for those, and, you know, just hoping for the best, really. You know, coming in for a health check and then spotting something, and to have it treated very quickly is brilliant, and then Hugo will hopefully be okay and life can resume as is, the new normal with Hugo, which I can't imagine a normal now without Hugo, because it's just such a fabric of my life already.
Come on, Hugo.
Come on, champ. Wake
Come
up.
on, big fella.
Time to go.
Let's go home.
Good boy.
Off we
Here we
go.
go. Good boy.
Thanks, Scott.
All
See
the
you
best,
soon.
Natalie. Bye, Hugo.
Bye.
Bye, handsome man.
Thanks, Scott. Bye.
Bye, mate.
See ya.
Bye.
Hugo, what's this? Are you interested or do you just want to sleep some more?
Is it steak?
No, it's dog food.
Oh, I want steak. Well, what are you having for dinner? Can I have some of that?
Hugo's favourite snack, I think, has to be cheese. It's closely followed by eggs, tomatoes and grapes. Here we go, dinner. Yummy. Scott gave us a call the other day to tell us the good news that he has the all clear, which is, yeah, brilliant news. Mwah. I was saying I wasn't worried, but underneath I was just desperate to get those results, and I don't think I'd realised how worried I was until we heard that he was okay, because I got really teary and was just so relieved.
Who's this? Who's this?
Hi, Hugo! What a greeting!
Hello. Come on, Bella. Come. What are we doing? Hiya.
It's always a little bit special when someone opens the door and I'm greeted by the big, handsome, gorgeous, wrinkly face that is Hugo with his big slobber chops. What's this, Hugo?
Oh, cheese. I love cheese. Give me paw. Oh, good boy.
So nicely as well. Oh, you love the cheese.
I love Natalie's Hugo voice. That is completely how he would sound. Would he be human?
Oh, big boy.
It might sound mad, but it kind of keeps me sane. And I hear the best part of all of this is that he's had the all clear from Scott.
Yes, he has. Such good news. And then I was a bit emotional when I heard, because I was just so relieved. So relieved. I just got a bit teary. We were out for walkies, weren't we, when we heard the news?
Hugo, can I have a look at it then? Can we have a peek
Gonna
to
show
see?
Auntie Emma.
Hey?
So since the surgery, Hugo's mouth is looking brilliant. There's barely a sign that any surgery has been performed. His gums are looking healthy, his teeth are looking great. So yes, very pleased with his progress.
Sometimes I think you're a dream. I do. Breaking hearts all over the place, you, aren't you?
Go on, give it a kiss. Oh, Hugo loves the ladies.
Naomi has brought Pablo in today because she left him at home yesterday, came home to find that he was limping.
Excited to be here, aren't you?
Good boy. I tried to pick him up and he did this almighty squeal. He just would not move. It was absolutely heartbreaking. I just wanted to wrap him up in cotton wool so I could get him to the vets to see what's the matter.
Hi Naomi, how are you? Hi, I'm Scott. How are you? Nice to meet you. Hello, handsome. He's lifting that right leg up, isn't he? What I might do is just get him to have just a little pot around, because I'd just like to see what's going on with that leg, if that's all right. Okay. It's quite ginger on that leg, isn't he? Just a bit sensitive. Well, there's definitely something wrong with that right leg. There's no doubt about that. So come on in. That's it. Good boy.
I'm just really hoping that he can just give me some answers and help me find out what's wrong with him.
Is this the first time he's ever had problems with this right leg?
He has had a few incidents before when he was a tiny baby.
Okay.
And then
What had happened on that incident?
He got attacked by another dog on one of his very first walks.
Oh no, what a
And,
nightmare.
Not good.
Yeah.
A couple of months later, we went to spend a weekend at doggy daycare and genuinely think he probably just overdid it. We rested him. Within a day, he was back to his sprightly self, absolutely normal.
Okay.
And then this has happened.
Oh dear. Well, let me have a little feel of this leg. Just holding around the shoulders there.
Come on then.
Okay. Good boy. Let's have a feel.
Good boy. Shh, shh, shh. All right.
Okay.
All right.
Well, you didn't like that, did you? No, you didn't. Okay. Well, straight away I can feel that the problem's in the hip.
Okay.
Because I just tried to extend his hip and he really didn't like it.
Good.
But actually,
All right. Shh, shh, shh.
bending his knee
Steady.
is fine. All right, champ. All right, mate. Oh dear.
Good.
Oh dear. Oh, that's still nice though. Oh, that's nice. I know. You're saying, I'll give you a kiss. I might nibble your ear off though if you do that again. Hey, oh, what have you done?
He loves this.
The way that Pablo is behaving and being so painful, I really think we need to push to the next step, which is x-rays. All right, you give Mummy a kiss.
Good.
Come on then, champ. Okay, break it up, you two. Naomi is obviously an incredibly dedicated owner. She wants the best for him, but he is a little baby and she's going to be worried about him. All right, you grab a seat.
Yeah, no problem.
See you in a second.
Okay. When you hear your baby scream, when your baby cry, it's never very nice. So I'm just hoping that Scott can help him today.
Hey guys,
Hi.
this is Pablo.
Hi, Pablo.
He has been described by his mum as a little bit of a tornado, quite
buddy.
the handful, and been quite calamitous across the course of his life. He got attacked by a Staffy, bless him, when he was about 10 weeks old. He's had a little bit of lameness, his mum said, ever since. But last couple of days, he's been really, really sore on this hip. So in examination, it was really painful. So, but he's getting on quite well. He's putting his leg down, so hopefully it isn't anything too major. Hey, Mummy's waiting upstairs for you, hey? So let's give her the good news, hopefully. Yeah? We have to knock you out first, though, don't we? Yes, we do. Yeah?
All right, think about this. Think about
Good
this,
boy,
buddy. Oh,
good
what a
boy.
good boy.
Oh, brave boy.
Oh, he's a very brave boy.
Brave boy. There we go. Now he's asleep, I can examine his hip properly without pain. But this feels way worse than this dog is presenting. He was skipping around, happy, enjoying his mum's cuddles. But feeling this hip, there's something quite serious going on here. So what I'm doing right now is just rotating his hip joint, and it's like a grating sound. Certainly not the beautiful, smooth, healthy joint that you would expect of a 6-month-old.
I've never left Pablo with anyone that I don't know, and I've only met Scott for the first time today, so I'm very eager to have my baby back.
She was spinning around the other way. Look at that, guys. Automatically, I see that's a problem. One long leg, one short leg. And look, it doesn't even want to stay out. Look, it's just tight. Okay, let's take these x-rays, shall we?
Oh, poor Pablo.
It's really quite unusual to see one leg shorter than the other. And in this case, I think it's caught us off guard because it just shows that this is a much more chronic injury than Naomi or I expected. Hi, Naomi. Thanks for waiting. I've got something I need to show you, so I think you should come downstairs. Okay. Come on down. So, I just need to show you these x-rays. It's quite a shock, actually. Yeah. What we're looking at here is an actual fracture, a broken bone in his hip.
Yeah, that doesn't look good at all.
No, it's not a clean break.
No.
So what I think may have happened is right back when he was 10 weeks old, this Staffy has really done a number on him, and this is actually broken at that stage. And then over the time between then and now, it's tried its best to heal, but done a really poor job.
Yeah.
And every time he clatters around the house and knocks stuff over,
Yeah.
he's re-breaking that.
Every time.
Yeah.
Okay.
So now I need for you to be brave because we need to do surgery on this leg. All right. I think what we're going to need to do with Pablo is perform something called a femoral head and neck ostectomy. It's basically removing the ball from that hip joint and just leaving a free-floating joint, and the muscles would take on the stresses and the strains of that joint.
Whatever he needs and whatever it takes.
Okay. Do you want to say goodbye to your chap? He's just laying just here. So you can, he's asleep, he's out of pain. All right, you jump in.
Oh, bless you. I promise.
You'll be okay.
So all of these things that all these things that you're seeing, it's just to help keep him asleep, okay? I know it's a little bit scary. The tubes are giving him oxygen and keeping him asleep, and he's got his drip on, and he's got various different machines to help us do our job.
Yeah.
Okay. I promise we'll look after him.
I know, it's like seeing your baby under anaesthetic. It's tough, isn't it?
I'm feeling pretty devastated that Pablo's actually got a broken hip instead of just a little bit of a pulled muscle. My little baby, who I thought was a wimp, is actually a little hero.
you head off.
Okay.
And I'll look after your boy, and I'll give you a call as soon as he's woken up.
Okay.
All right?
Yeah.
It's a complete and utter shock that Pablo has to have surgery. Probably my worst nightmare.
We'll see you in a bit then, eh? All right, come on out. So I'm just going to start scrubbing. Every animal that we treat is loved by their owners, but I think that there is a very special bond between Naomi and Pablo, a little bit like mother and son, and he is still a puppy, so he's like her baby. So yeah, maybe a little bit of added pressure. So I'm just about to make the first incision to expose Pablo's hip. I really don't know what I'm going to find. I don't know if, based on that x-ray, if the femoral head and neck are actually attached or they're separated. So it's only once I get in through all the muscles and then into the joint capsule will I know, and then I know what I need to do, which is to remove that femoral head. This boy's got some insulation. He's a little bit on the portly side, isn't he?
Just a little.
So it's basically cutting through the skin, through all the support tissues, through muscle, to get to the joint capsule, which is basically the bag protecting the joint itself. Yeah, I'm just going into the joint capsule, so I'm finally going to see what the hip looks like. Oops, it's full of blood. Straight away, I know it's way worse than I even anticipated because blood comes flying out of that capsule, which just shows how traumatic the injury has been for poor Pablo. I've got my finger inside Pablo's joint capsule and I can feel the ball of the hip socket is not attached to his thigh bone. And you might think, oh, that's great, you know, it's easy, you just pop it out. In fact, no. Because I can't lever it out using his leg, I have to go fishing for it. And that actually is, yeah, quite difficult.
Yeah.
Oh, God, it's so awkward. That's the muscle that's giving me so much grief. Yeah. So just if you can try and keep that out of the way, and then I just.
Am I okay to hold it like this? No.
Yeah, that's fine. It is so difficult because the round ligament, the ligament that attaches the femoral head into the socket itself, has sort of grown exponentially, and that's probably because there's been a history of instability, and the body's a very clever thing, so it's tried to stabilize the joint, and it's done that by increasing the size of this ligament. But for me as the surgeon trying to get it out, it's meant for a lot more difficulty. Oh, come on. Okay. That's that fractured femoral head that we could see on that x-ray. Oh, look at how thick that round ligament is.
That's insane.
After I've got the femoral head out, the next step is just trying to make sure that there isn't any bony contact between the thigh bone and the hip joint. Because if we get any grating or any rubbing, that's going to cause pain, and that's going to mean that Pablo won't use his leg. So I use what looks like a chisel to basically get rid of any bony attachments, little bony pieces, make it nice and flat, and that'll mean for a nice comfortable joint. Just little bits like that that are going to rub. Great, I can start closing up now. It's a massive relief to be able to close up Pablo and have him wake up. Here we go. Oh, look. Mummy even dropped off your teddy bear. Look at that. Hey? There you go. Good boy. It's possible that there could be more complications with this procedure just purely because of how difficult it was to get the femoral head out. But I'm hopeful that I've managed to get it out without causing injury, but let's see how he recovers.
I've been feeling nervous, excited to see him, anxious that he's okay because I'm worried that he might be missing me.
All right, mate. Good boy. Look at you putting that leg down. What a clever chap. What a good boy. Hello, mate. Oh, gosh, you're crazy, aren't you? Hey, you're crazy. Yes, you are. Come here. Come on, then. Oh, let's go see Mummy. I think I hear her. Let's go see Mummy. Come on.
I can't wait to see him.
Hello.
Hello.
There's your chat.
Hello. Hi. To have Pablo back feels amazing. I can't believe how much I missed him and how much he obviously missed me. It's so good to be together again.
Okay, down you go, mate. There you go. Right. There you go.
Hey,
So you can see already how brave he's been.
Look at you.
Legs already
Look at you.
touching the ground.
Hello. Let me see. Look at you, brave boy. Yes, steady, steady. Good boy.
He's already putting his leg on the ground there, which is just such a great result. But now is your turn.
Okay.
So what you need to do is start with some physiotherapy. So the most basic thing is just to get him to use this leg. We need him to use it as much as he can, as quick as he can.
Okay.
So the first thing is just lifting the other leg up.
Yeah.
So when you lift the other leg up, just ask him to put pressure on that leg.
Okay.
But he's been such a brave boy and such a great patient.
Good.
And now you just need to convince your boy to use his leg.
Yes, he will.
Hey?
Yes. I can already see improvements with Pablo's leg. He's spreading his toes a lot more than he was before, and he's putting a little bit of weight on his leg, so I can definitely already see improvements. And I literally can't wait to take him home and just get my baby back. I love him so much.
All right,
Ready?
bye, Pablo.
Say bye.
See you, mates.
Say bye. Steady,
Take care.
Steady. Good boy. Good boy. Come on then. Good boy.
Good boy.
Pablo. Ready, steady, go. Good boy. Come on, Pablo. Come on then. Good boy. Good boy. Clever puppy. Come on then. Pablo is fantastic. He's making a good recovery. His muscle mass has started to grow a little bit more. He's using his leg fantastically. Anybody would think that nothing had ever happened to him.
This way. Where's Pablo? Hey, where is he? Hey, where's Pablo? Who's that? Hi, Naomi.
Hi.
How are you? Hi,
Good, thank you.
Pablo.
How are you?
Mwah. Good to see you.
too.
I thought I'd bring a little play date friend
Yay,
today.
We love new friends.
Yes.
Scott brought his puppy along so that Scott can see how Pablo can really move with other dogs, really see him in action. Also, it's really good socialisation for them. Go play then.
Wow,
Good
jumping
boy.
already.
Yes.
You're doing
Hello,
well.
darling. Hello.
He's looking very active
Yeah,
and
very, very active.
very comfortable.
Yes, I've got my dog back.
Pablo's moving really well, and most of all, he seems to be out of pain, so it all seems very positive.
He could never do anything like this before. His favourite time is coming out in the park. He
Yeah.
absolutely loves it out here. You can
hear.
see. It's like he owns the place.
Yeah. Stop. Come on, you two. Play nicely. So often with patients, it's a mixture of physical and mental. And I think for him, he's lived pretty much his whole life with a sore hip
Yeah.
and not being able to use it normally. So now it's almost like you don't have a painful hip anymore. We just need to retrain you to use it.
Yeah.
And it's hard as an overprotective mum to go,
I'm
oh, my boy,
I'm
oh, he's
terrible.
jumping. But actually now, you need to just let him go
Let him
for
do it. Definitely. Definitely. The future for me and Pablo is to just enjoy a long, long life together, hopefully. Lots and lots of walking, lots and lots of treats, and lots of cuddles.
Come on, Scully. Good girl.
Pablo!
Come on.
Pablo!
They're already falling out. It's only their first date.
Good boy.
What are you saying? Let's look at this lumpy bit. Yeah, it's a real big lump, isn't it?
We were actually on a yacht off the coast of Corsica when it happened, and I got a call from Scott's practice to say that Bella had obviously suffered major trauma to her tail, and that in all likelihood she would have to have it amputated.
Doesn't hurt, does it, Belle, when I touch your tail? Eh? Does it?
I don't know, I was in shock really, because when you're on a boat off the coast of Corsica and your phone goes, you don't really expect to be hearing that sort of news.
It was probably your curiosity that got you into this scrape with your tail, wasn't it, Bella? But we'll never know, will we?
The bad news was that the tail is badly dislocated, but the good news was that she had no other injury. Nobody's going to see what a lovely tail it was when it used to stick up from her body at 90 degrees, and she was always... She's been, really crying loudly and making her discontent known. Okay, come on then, Belle. Come on then. In you go. Good girl. Right, there you go. So it's sad, but I'd rather have her safe, and she's got, I don't think it'd bother her at all, actually, because she's just that personality, but I think she'll just take it in her stride. Okay, Belle, make yourself comfortable, because now we're off, okay? Big adventure, Belle. Come on then. Come on, Belle. You're coming to see Scott, aren't you? Come on. Yeah, I know.
Morning, Kathy.
Hi, Scott.
Hi, Bella.
Hello.
Hi, gorgeous girl. Come on in.
Yeah, say hello to Scott.
Hello, beautiful. How's things? So it's been about 3 weeks, isn't it, since we've seen each other?
Has, yeah.
How do you feel things have been going?
She's been her usual demanding
Yeah.
cat with attitude self, jumping all over the furniture.
But we've still got a very floppy tail, haven't we?
Yeah.
To actually dislocate a tail, pull 2 vertebrae apart, that would have really hurt, and would have been done at quite some velocity. So generally it's a cat that's run, got caught in something, been run over, kept running, and the tail dislocates. What I'm going to do is just do a quick deep pain test. I'm digging my fingernail in there, and there's not the greatest of response there. She should be really quite painful, and the fact that she isn't would suggest that there's a level of nerve loss or nerve damage. This tail, being that it's not being positioned properly, can be caught indoors, can be caught on fences, can be caught up trees. If she has a good tug on that again, it can go from a significant injury to an absolute nightmare. So I do think in this instance that it is probably the best option to consider amputating the tail.
If we don't take it off, every time she goes out, I'll probably always be worried that something's going to happen to it and happen to her because she can't control it.
So that's exactly where we'll take it off from that point.
Right.
The risks of doing this procedure are that as there is a huge amount of nerves at the base of the tail there, you can damage their ability to do things like control anal tone. So it might be, in worst case scenario, that she becomes incontinent. That's the worst case scenario. Bella's surgery is a tricky one because of where the dislocation is in relation to her bottom. The base of the tail and where that is very, very close together. And there's a huge amount of nerves in that area. And if you cut the wrong one, you can stop her feeling that back end area, and you can lead to lots of problems, incontinence being one of them. And that's the last thing we need with Bella.
So you're poor little Belle. But you're going to be fine, aren't you, Belle? Because you're a tough girl, aren't you?
Tough cookie.
You are. Yeah. It's funny, she's quite comfortable. Normally she doesn't like to be held by someone who's decided to hold her. She doesn't mind if she's decided.
I know, you're being affectionate to the guy about to take your tail off. Not a great choice. But at least she obviously trusts me, which is nice, isn't it? Yeah?
Here she is.
Hello, Bella. You're being
Little
feisty. Hey. You're not very happy now, are you, with that horrible catheter in?
No.
She's so beautiful, isn't she?
Yeah, she's a lovely girlie.
Look at the eyes on it, hey. They're amazing. It's such a shame. Take that beautiful tail away, but it's just floating in the breeze now. It's just an accident waiting to happen, so definitely the right thing to do to remove it. Doing a surgery like this on a beautiful cat, it is heartbreaking when you have to change their appearance forever. To remove such a beautiful appendage is a real shame. She's a beautiful cat, it was a beautiful tail, but she will continue to be beautiful even when the tail's gone. Yeah, it's a procedure that I'm a little nervous about because it is a massive change for Kathy. The Bella is going to look completely different, but I definitely need to make sure that's the only surprise in store. And if a cat gets incontinence as a result of this procedure, then very rarely does the cat survive. Perfect. Good. There we go. Right.
Let's go.
Last time we're going to see this tail where it is. Quite a nerve-wracking one, this just purely because we've got a dislocation that's just so close to the base of the tail there. Lots of very important things in that region. Very, very high up.
Yeah.
Probably one of the highest up I've ever done. And bloody close to this poor little girl's bottom.
Yeah.
I had a cat through university that had a tail pull injury, and sadly after 2 weeks he was unable to control his bladder and his bowels, and he did have to get put to sleep. So I know the heartbreak of this type of injury and when it goes badly, and I definitely don't want that for Kathy. So I'm just to the point now where I'm about to sever the spinal cord, which is obviously a nervous moment. You want to be damn sure that you're in the right position. There we go.
There we go. It's off.
Yeah, sorry, sweetie. Right, let's get this closed up now, shall we? Kathy tells me that Bella is quite the fighter. I feel that that sort of tenacity is really going to help get her through, recover from this surgery and go on to live a happy life.
Beautiful. Even with the little tongue.
Yeah. What's that?
All right, Bella, what a good girl. Let's have a quick check. Hey, I know you're not happy about that collar, are you? I know, but it's got to stay on, sweetheart. I'm very sorry. I apologise. We took your tail. We're taking your dignity slightly. Good girl, good girl. I know, and keep your nails to yourself, please. Good girl. Bella, now. That's not going to work, my friend. Can we leave the collar in place for 30 seconds? Unlike the one you destroyed overnight. She's eating, she's drinking, her vitals are all within normal limits, everything that we'd expect. She's had a poo, which in the nursing world is thumbs up.
Hey, Kathy, how you doing?
Scott.
You're right.
Yes, I'm fine. How are you?
Good, yes, very well. And so's your girl. She's just through in the consult room, so follow me through.
Yeah, I'm excited to see her.
Hello. Hi, Belle. It's been a big adventure, hasn't it, Belle?
So true to form, she's been quite the performance artist overnight. She absolutely ransacked her cage. She had this pulled off, but thankfully, she's left herself alone. So this is her new look back end.
Oh my gosh, that looks great, doesn't it?
So
It doesn't even look like she's had surgery. So I was really amazed, very pleasantly so, to see that it all looks so good. I mean, it looks like it was done, a couple of weeks ago.
The hell? That looks great.
But I still think her name applies, in that although she doesn't have a tail, she's still Bella. She's still beautiful.
She is, yeah.
And
But
I'm sure.
She looks great.
I'm glad that you're happy with it, because it's a strange looking back end.
But I mean, her fur will grow back.
The fur will grow back, and it'll literally fade away. And certainly from this cat's point of view, she's a feisty little madam, aren't you? And you're going to be absolutely fine, aren't you? Yes, yes, yes. Get me out of here before they take anything else off. I absolutely feel like we've all made the right decision. Not only does Bella seem more comfortable now the tail's gone, but it means that her future is secured, and now she can go out and about and enjoy the great outdoors yet again. And Kathy can be sitting resplendent on her couch, sipping a nice cup of tea without a worry in the world. All right, all the best. Bye, Bella.
Bye, Bella.
See ya.
Bye-bye.
Bye.
Mr. Lucky. Mr. Lucky. Bella, she's the boss, and generally it's quite a loving relationship, except that she can be quite horrible to him sometimes. She can spit at him 1 minute and then turn round and give him the most lovely grooming and lick his face. Oh, Bella, that is nice. Mr. Lucky just has to put up with what he gets. Everything has to be on her terms, really. He's obviously okay with it. Actually, yeah, I haven't forgotten that this is the cat flap. Big adventure. You can go out again. Yeah. Yeah, you're just familiarising yourself again with everything. She's just loving it, and she's just, her confidence, hasn't taken a dent at all. There you go, back in one of your favourite places, aren't you? She's always been a small cat with a big attitude, and she's exactly the same.
Hello.
Hello, Scott.
How are you?
I'm very well, thank you.
Good.
How are you?
I'm very well. I'm very much looking forward to
Good.
to seeing your beautiful girl.
Well, I think you'll be very pleased with her, actually. So come in.
Thank you very much. Let's have a quick look at this and just see. That looks great, doesn't it? I mean, obviously it looks a little odd, but the fact that she's functionally okay and toileting okay as well, that's not been a problem?
No, not at all. Yeah, she hasn't lost any confidence.
The fact that she seems completely unaffected by it, don't you? Hey?
You're still a total flirt, aren't you? Yes, you are. Yes, you are.
I've no regrets at all, and I think if any other cat owner was in a similar situation, I don't think they'd have to worry about it. It's just nice to see them going off and having adventures. But it's nice to see them coming back safely as well.